Can you help therapists and patients to understand what to do when a patient is treated and then feels worse after a session?
Yeah, this is why I recommend that this is an educational process for your patients and clients also. This is why I recommend you say a number of things to them the first visit. Start with, I'll never injure you. The worst with myofascial release can happen is nothing. Can't guarantee anything in healthcare. There's also the possibility of something called the healing crisis. And traditional therapy feel good after treatment usually, but the problem is to get down to the parking lot and symptoms return already. That's why I occasionally call it the parking lot therapy. So with myofascial release, sometimes you'll feel better, but many times you'll actually get stirred up. And it's called the healing crisis. It's been ignored for centuries, but again, traditional therapy completely ignored it because it has to do with your mind. God forbid. So let them know they may get stirred up that night or the next day. The healing crisis can last for a couple hours, even a couple of days, 2 or 3 days. And tell them not to be running to the medicine cabinet and taking pills or drinking, trying to anesthetize yourself so you don't feel. It can be very intense. What you have to emphasize to your patients is it's not injurious. You have to repeat that and repeat that. Because people in Channel 5 don't listen to them. And they're scared. So just kind of keep reminding them, this is not injurious, and it will pass. But if you take drugs or get a nice massage or put lavender in your big toe, it's avoiding the healing process. So you'll go through it again, except it's going to be worse the next time. So stay with it. This is why we teach our patients to treat themselves. The best thing to do is get treatment as soon as you can. That'll speed you through it and deepen the process. So when you first do it, there's times it gets so intense, you actually think I should be going to the emergency room, you know. So stick with it if you can. And myofascial release takes us into the shadow side of the world. Dr. Carl Jung, the famous psychiatrist, said many years ago that if we don't deal with the shadow of the human being, it will always present itself as aberrant behavior or a symptomatic complex. So traditional thought, we avoid the shadow, we ignore it, we medicate ourselves, we drink too much, we talk too much, we think too much, anything we can do to distract ourselves. So when myofascial release helps you go into the shadows safely, and when we do, we find the light. That's your essence.